Just some back history about Alzheimer's disease. It was first discovered in 1907 by Dr. Alois Alzheimer. He was a German doctor who was studying a woman in her senile, elderly ages of 40. And back in the day, in the turn of the century, our average daily lifespan was about 38. And so luckily now, we're all in this room for a reason. But if this were 1907, certainly being the age that we are today, we would be either considered very elderly or a miracle to be around. And plaque is like if you haven't brushed your teeth at the end of the day, you have that buildup. And same with tangles. They're like little silk-like fibers that have wrapped around the healthy parts of the brain. And we have found these to first start in the hippocampus. The hippocampus is a small part of the brain that stores all of our short-term memory. So if you think back to this morning, does everyone remember what they've had for breakfast? Hopefully you had breakfast. I had a bagel with cream cheese. Okay.
I had cereal.
Good.
Cereal.
So the fact that you remember is good, right? Because that is something that's stored in your short-term memory. That is in your hippocampus. Or that is your short-term memory, which is stored in your hippocampus. That means that your hippocampus is working, okay? Eventually, your hippocampus is going to get full, and those memories are going to expand into the rest of your brain. And that's where most of your long-term memory is stored, in different parts of your brain. Normally, we hear about the right side or the left side. So eventually, those long-term memories, how to speak your language, how to read and write, will be stored in the proper parts of the brain. But that holding tank is still where all of your short-term memory is stored, in that hippocampus. When a person has Alzheimer's disease, that damage is happening in that holding tank. So that is why people with Alzheimer's disease very clearly remember long-term memory. Where they grew up, the name of their mother and father, their elementary school, the first job that they had. Often that's why they're living when they're 15, 20, 25 years old, because those are long-term memories that are still intact in the healthy part of the brain. But whether or not they had dinner, whether or not they took a shower, sometimes who you are, because of the way that you look today, is hard for them. Because their long-term memory is saying that you are 10 years old, especially if you're their child. If you're their spouse, they're saying, well, then you're 25 years old. Because I certainly didn't marry that gray-haired lady over there. I married a really good-looking broad at 25, and I don't know who you are. Do you see what I'm saying? So just close your eyes for a few seconds, if you will, and envision yourself waking up in a room tomorrow morning. The walls are very different. The pictures on the walls are none that you recognize. The clothes in the closet you've never seen before. There's strange smells, there's strange sounds. There's even strange language being said in the next room. Then quickly a person walks into the room and says, "Mom, it's time to get up. Come on, let's get going." And you think, what in the world? Who is this adult telling me, "Mom, I don't even have a child this age. I have a 2-year-old. And why is she telling me I need to hurry up and get up? I don't even know what time it is. This isn't even my room. Where am I?" Just imagine a person with short-term memory loss, not knowing who they are, where they are, who you are, why they're there, where their things are, what they're supposed to be doing, where they're supposed to be going, and this is the reason why they act the way they do. So some of the common ways that they act is through frustration, through anger, through asking repeated questions, constantly needing reassurance, constantly needing to know who you are, who they are, where are they going, where are you going. And it's tough, but at least now we can understand that it's because it's that short-term memory. It's just not working. It's like a sponge that's non-absorbent. That memory comes in and bounces right back out. Make sure that you have someone that is a specialist. If you have an issue with your foot, you often want to go to the podiatrist. If you have an issue with cancer, you'd want to go to an oncologist. You want the best that there is that's a specialist in that area. And the same goes for Alzheimer's disease. It's a brain disorder. So we recommend a team of specialists, a geriatric, working with this population, psychiatrist, neurologist, and certainly a geriatric doctor as well. The main thing is you want to exclude any other reason why a person could be behaving this way. It could be something as simple as a vitamin deficiency. It can be a urinary tract infection. It can be any other type of dementia. It can be that a person is having mini strokes and you don't realize it because they're having them in the middle of the night. If you have dementia, it doesn't necessarily mean you have Alzheimer's disease. You can have dementia for other reasons. For example, if you have Parkinson's disease, it's not Alzheimer's disease, but it is another medical condition that can cause dementia. It may or may not. You can have had a major stroke, and because of that damage, you now have dementia. It's not always. You may or may not, during your recovery, have dementia. You can have cancer, and after all of your treatments, you now can have or may not have dementia. But there are hundreds of reasons why you can have dementia. But just because you have dementia does not mean you have Alzheimer's disease. The treatment is the same because the behaviors are the same. Whether you have dementia because you had a stroke, or whether it's because you have full-fledged Alzheimer's disease, you still have memory loss, confusion, behavior changes. Those things are still going to happen. Now, each person is going to have different severity in any one of those levels. You can have 100 different symptoms because of the dementia, but it doesn't mean that each person is going to have the same. One person can be very aggressive and one person can be very passive. One person can be very angry and one person can be elated all the time. Sometimes their personalities completely change, sometimes their personalities are more emphasized. We don't necessarily know until you eventually go through all of the stages. Beta-cholinesterase inhibitors are Aricept, which is the most commonly used, Exelon, and Razidine. Razidine was called Reminil when it first came out on the market, but it had to change its name because there was a medication that was too close to it. But each one has different side effects. Most of the side effects are GI, so diarrhea, constipation, vomiting, loss of appetite. Also, they can cause very severe hallucinations and very severe sleep changes and sleep pattern changes. So what we find is that if a person tolerates it well, then we have them on it as long as possible. We know that the efficacy is anywhere from 6 months to 1.5 years. It's a very short period of time, but we don't know when that efficacy period is happening. So you could have the person on it for 10 years, and you're only hoping that you started it soon enough, or you don't take them off of it too early, because you don't know. Originally, it was just for moderate, mild to moderate, but now they're giving that medication, the acetylcholinesterase inhibitors, to all stages. What the medication does is it slows down the progression. What we knew about Alzheimer's disease is that the progression is a slow downhill slope. And what we hope with the acetylcholinesterase inhibitors is that it's more of a step. So the stairway effect is that it stops it, it goes a little bit, stops it, goes a little bit, instead of a continual decline. As long as the person tolerates the medication, as long as your insurance is able to cover it and it's financially sound for you to have your loved one on it for 10 to 20 years, have them on it. As long as they are walking, talking, eating, and doing activities, it's worthwhile. But if they can't tolerate it, you can't afford it, and they are in the severe end stages, then there's no use anymore. I'm not a medical professional, so I don't recommend you only take my advice, but that is the standard advice given. What we first recommend is that you take these classes and you learn all about it. You learn how to communicate well, you learn how to have more patience, you attend a support group so you have a place to vent, you have a daycare so you get a break and they have structure. Sometimes it doesn't work. Sometimes medication is necessary. And sometimes medication is just, because no one should live their days stressed, depressed, angry, violent. And sometimes that is going to happen with Alzheimer's disease.